Hello, my name's Nat Whitley. I'm the head of medicine at Davies Veterinary Specialists. Today I'm going to talk about a couple of dilemmas in relation to giving booster vaccinations. But before that, a little bit of history, because there's been a lot of controversy in the media and media attention to vaccinating practices. So a lot has changed in the last couple of decades. This veterinary waiting room represents what things sometimes look like in some practices when I first graduated. And at that time, it was standard practice to give the same booster to dogs every year and the same booster to cats every year, covering several different diseases. This wasn't really based on sound immunological or scientific practice. But then in the 90s, we had almost a perfect storm developing of media events and scientific observations. So one of the first things was the observation that some cats developed tumours or sarcomas at the sites of injections, particularly vaccines. These are now known as injection site sarcomas. And also there was a study in the United States with a drug company trying to develop a vaccine against feline infectious peritonitis, where the vaccinates developed more disease than the control group. And then that was quickly followed by the MMR scandal in human medicine, which was a fraudulent study covered quite irresponsibly in the media, but did lasting damage to human vaccination practices. While this was going on, the public appetite for veterinary programs in the press and on TV was ever increasing, and rightly so, veterinary vaccination practices came under quite close scrutiny. Since then, a lot has changed. We now have some excellent scientific guidelines from a number of professional bodies, collections of experts who've got together and developed policy documents for best practice for vaccination in a number of different situations. The one I refer to most and the most prominent are the WUSA VA guidelines, but these have been based partly on guidelines developed by other professional bodies, the European Advisory Bureau on Cat Diseases, a couple of American professional bodies, and also BSAVA and BVA these days have their own policy documents on vaccination to help us develop guidelines for our own practice. We shouldn't forget also the very important role of the vaccine manufacturers in evolving and developing their products and their recommendations and gaining new data. So the product data sheets from vaccine manufacturers are also very important in making decisions on vaccination in your practice. Just a little bit more about the WUSA VA guidelines. They're very comprehensive. They will guide you through best practice for vaccinating young animals, booster vaccines in different situations. So animal rescue shelters and centres, pets kept indoors, outdoor pets, old pets, young pets. In particular, the section at the end on frequently asked questions is very, very useful and something I refer to quite often. I should emphasise that these are guidelines and that they're not always agreed with particular vaccine manufacturers. So you have to make your own professional judgment based on what the vaccine manufacturer and the product data sheet says, matched up against the recommendations of WUSA VA, whichever other professional set of guidelines you're following. The WUSA VA website has a PDF copy of the latest set of guidelines free to download, and WUSA VA updated theirs last time at the end of 2015. So that brings me to these couple of questions that I received quite a few phone calls and emails about, and so do my colleagues. The first one I'm going to talk about is whether to give a booster vaccination to a pet who has recently recovered from an immune-mediated disease, for example, autoimmune hemolytic anemia or immune-mediated thrombocytopenia or polyarthritis, something like that. So it's not always an easy decision. The first question I ask myself in trying to answer this question is the booster really necessary? And for that, we have a relatively recent tool. So we have easily accessible vaccine serology. So we can measure antibody levels against the diseases which vaccines are protecting against, particularly for dogs. It's not quite so useful for cats, but in dogs, it's very useful for the core diseases, parvovirus, distemper, and canine infectious hepatitis or adenovirus. Less useful for leptospirosis. But if there is an antibody titer against these core diseases, then that's good evidence of protection against the disease. There is a caveat here, however. Using vaccine serology isn't the be-all and end-all of interrogating the immune system. We have to remember that there's this other division or arm of the immune system, which is all about T cells, and that's where immunological memory resides, and that's very, very hard to measure by laboratory methods. So just because we can't measure antibodies in a given patient, that doesn't guarantee that the patient doesn't have some residual immunity against the disease. And it's important to keep that in mind and be open with your clients when you're trying to help guide them on a decision whether to give a booster or not to some of these tricky patients. The other question I would ask is, what are the risks of giving a booster? And these are often quite hard to quantify. We have to remember that vaccines are drugs, and giving any drug means introducing a foreign material into the body, so there's always some risk of reaction, albeit normally very low. However, vaccines are specifically designed to stimulate the immune system, and I think that's where the worry and the concern resides in these patients with immune-mediated disease. Could we stimulate them back into their disease inadvertently? Why would we be worried about this? Well, we have to think about why immune-mediated diseases develop in the first place. For most of our patients, the answer is complex. It's some combination of the genetic background of an individual. For example, we know that Cocker Spaniels, many of them are skewed towards autoimmunity. They're overrepresented in the patients we see with hemolytic anemia and thrombocytopenia, for example. But it's not all about genetics. There are environmental factors as well, and that includes what infections a patient encounters in the environment, possibly what toxins are around, and what products and drugs and foods they're exposed to. So vaccines all come into the mix there in trying to decide on the risk of giving a booster. I would be remiss not to mention this study, which appeared in 1996, and this has generated a lot of the criticism and skepticism about booster vaccinations in veterinary medicine. So this was a seminal study by Derek DuValon and Urs Giger at the University of Pennsylvania, looking at their patients, their dogs that had immune-mediated hemolytic anemia, and they made an unprecedented observation, which was that an unusual number of patients that had the hemolytic anemia had received some sort of vaccine, be it a booster or a primary course vaccine, within the month prior to the disease being diagnosed. And there were reasonable numbers of patients in this study for a veterinary study. So, of course, when this study came out, everyone else doing an immunological study also started looking at the timing of vaccinations. And I need to make a couple of points here. Firstly, to say that just because a vaccine was given in the month before an immune disease developed, that doesn't prove causality. It could just be coincidence. And there may have been a number of other products given at the same time as a vaccine that have not received the same level of scrutiny. So I'm generally in favour of trying to defend vaccination as a good thing rather than a dangerous thing. The other thing to say is that any investigator publishing a subsequent study on immune-mediated disease because of this DuValon Giger study has looked at vaccines, and there have been numerous other studies since the DuValon Giger study, and none of them have been able to repeat the same observations. So we need to be a little bit skeptical about whether that paper is truly representative of what happens all over the world in an ongoing basis. We more recently have another excellent study to, if you like, counter a little bit the information provided in the DuValon Giger study. This study was presented at a major congress in America last year. The authors were a UK group, and they asked perhaps a slightly more important question. Not did the vaccine cause the immune disease in the first place, but more pertinent to the questions we tend to get, is it safe to give a booster vaccination to a pet that has previously suffered an immune-mediated disease? They looked at a different disease from the DuValon Giger group. This is looking at immune-mediated thrombocytopenia. And they looked at all the patients in their referral practice that had been diagnosed with this disease over quite a number of years and followed them out, so follow-up phone calls to the owners and vets to see whether these patients, after they'd recovered from the disease, had subsequently received any booster vaccinations, and if they did, what had happened. In other words, did any of these patients relapse in their immune disease following a booster vaccination? And the results were really interesting. They found 21 dogs in total that were in remission, had recovered from their immune disease, and out of these, 9 of the patients received no further vaccines during the study period, and none of them had relapses in their immune disease. So it's a disease that didn't seem didn't have a particularly high incidence of relapse. But 11 of the dogs did receive booster vaccines, some of them multiple boosters over several years, and none of these dogs relapsed. So for me, that offered great reassurance that giving boosters to patients, provided you're fairly sure they've recovered from the immune-mediated disease, is a relatively safe thing to do. To look at the other side of the coin, we have to think, what are the risks of not giving a booster vaccination? Are there some patients that are very likely to contract an infectious disease if we fail to maintain adequate vaccine protection? You could argue that seronegative dogs, dogs without measurable antibody levels to parvo distemper hepatitis, would be at increased risk, with the caveat that we haven't looked at cell-mediated immunity, and I'm not talking about leptospirosis here. That's a different situation for lepto. There are also some dogs living in certain situations where their lifestyle or the things the dogs are used for might put them at higher risk of contracting an infectious disease. We might think of dogs living in inner city environments, deprived environments, with a lot of unvaccinated dogs around, as dogs that would be at higher risk, for example, of parvovirus or distemper. We might think of farm dogs, dogs living in or around cattle, the farm collie, perhaps working gun dogs, dogs running across open farmland, especially in winter, or dogs going swimming a lot in and out of lakes and rivers and streams as perhaps at higher risk of leptospirosis. And so those would be dogs I would be particularly keen to maintain booster vaccinations for lepto in. So I hope that's offered a little bit of guidelines about boosters in patients with previous immune-mediated disease. Here's another question that we get, and this is for patients that are still receiving immunosuppressant drugs. It might not be for one of the classic autoimmune diseases like hemolytic anemia or thrombocytopenia. It might be, for example, an allergic dog with skin disease, atopic dermatitis, that is receiving chronic steroids or cyclosporin or other immunosuppressants. So there may be good reasons to want to give a booster to one of these patients, particularly if the immunosuppressive therapy is long-term. And in answering this question, I've referred heavily to the WUSA VA guidelines, and the guidelines are slightly different. The guidelines differ in terms of what type of immunosuppressant they're receiving. So it's a bit different if they're getting steroids compared with if they're getting a cytotoxic immunosuppressive drug. If they're receiving chronic steroid therapy, the frequently asked question number 45 in the WUSA VA guidelines helps us answer this. So studies both in dogs and cats receiving steroids show that they can still mount good humoral immune responses to vaccines while they're receiving steroids. If you can get them off steroids, revaccination is recommended 2 weeks later. So that's a pretty useful piece of information based on published studies. For cytotoxic drugs, it's a little bit different, but also quite interesting. So WUSA VA, in agreement with product data sheets for licensed forms of cyclosporin, would say that it's not particularly safe and it's inadvisable to give a booster vaccine, particularly a modified live vaccine, to a patient receiving an immunosuppressant drug that is potentially cytotoxic or basically any drug other than glucocorticoids. So this would include cyclosporin. The argument for this is that a modified live product in the vaccine could actually cause vaccinal disease, whereas a killed product, which tend to be more heavily adjuvanted, is more likely to stimulate the immune system to the point where it could risk a relapse of the immune-mediated disease if they're receiving immunosuppressant drugs at the time. But there's an interesting postscript to this that maybe lessens some of the concerns, and this is a 2015 study on cats receiving very high doses of cyclosporin, so approximately 3 times the standard therapeutic dose of cyclosporin. And these cats were given booster vaccines, and they were also given a primary course of a new vaccine against FIV. So this was an American study. We don't have FIV vaccines in the UK. But the results were very interesting, and they showed that patients on cyclosporin were incapable of developing a protective immune response against a new vaccine, if you like, a primary course. When these cats receiving cyclosporin were given boosters, the situation was quite different. So the memory response of the immune system seemed to be much more intact, so they could measure increasing antibody titers against the diseases they were boosting these cats against. So that's a vital piece of information, relatively new study that's come out that maybe offers some reassurance that if we inadvertently gave a vaccine to a patient not realizing it was still receiving immunosuppressants, it's fairly unlikely that anything terribly bad would happen. Just to try and wrap up where we've been to and where we're at now, we need to continue vaccinating pets to protect not only individuals, but to try and maintain the herd immunity, this level of a protection in the general pet population that is so important for protecting vulnerable pets that maybe hadn't received their vaccines yet. So I'm very much pro-vaccine and trying to maintain herd immunity, as is the drive in human medicine as well for things like measles, mumps and rubella. We also need to be quite careful to make sure that any publicity surrounding vaccines is based on scientific evidence, to avoid, if you like, the media storm of things going viral, if you'll forgive the analogy, based on anecdote and opinion that isn't backed up by scientific data. That has been a notable problem in first opinion practice recently. Finally, it's important that we recognise that our knowledge is still evolving in how to give vaccines according to best scientific practice. We'll get new studies following long-term duration of immunity in response to vaccines, and hopefully we'll get easier ways of interrogating cell-mediated immunity. So in deciding whether to give a booster vaccine or not, it won't be all about measuring antibodies. There may be other ways of assessing whether a patient is still immune or not. And this should help vets and the general public and vaccine manufacturers in using the products most efficiently and safely. Thank you.